DatSCAN contains a dopamine transporter radioligand and is used to assess presynaptic striatal uptake in the basal ganglia of the brain.
DatSCAN is a radiopharmaceutical, and as every radiopharmaceutical, it has two parts. The radioactive part, it's iodine 123, and it's used for the signal. It gives us the image. And then it has the binding part, the molecule of ioflupane. And this molecule has a feature, it binds the specific presynaptic receptors in basal ganglia. So this feature allows us to monitor the function of these structures and to find some specific diseases of these pathways. So when we are talking about the procedure of DatSCAN, how do we do this? The dose is usually given in megabecquerels and in nuclear medicine, and the dose of DatSCAN injection is 185 megabecquerels. The length of the examination, it takes application, and then you have a waiting time for 3 to 6 hours. And after this waiting time, the patient gets under the camera, and the imaging, the process of getting the images, acquisition of the images, it lasts 60 minutes maximum.
In order to prepare for the DatSCAN examination, two things must be done.
First is how should the patient be prepared, and there are no strict guidelines. Actually, the patient should be well hydrated for this examination. There is no problem with the food, and there are certain drugs that should be taken out during the examination. And the second question is what should be done in the lab to have the vial and to have the syringe prepared and to use it. And in the case of DatSCAN, it's very simple. There is a vial and the solution is ready to use, so the lab worker only takes the desired activity and it can be put in the syringe and then to the patient.
A thyroid blocker must be administered 1 hour before the scan.
It is important to perform a thyroid blockade before DatSCAN examination, and that's because in this radiopharmaceutical there can be free iodine which would accumulate in the thyroid gland and it would deliver unnecessary radioactivity to the thyroid, and that's what we do not want. So there are certain pills that can be used approximately 1 hour before the examination to prevent this unnecessary accumulation of free iodine in thyroid.
There are certain safety measures which must be performed before and during the DatSCAN examination in order to protect clinical personnel from any unnecessary radiation exposure.
As general in every other nuclear medicine examination, there should be protection with a distance. It means to keep the distance from the patient once he is applied with radioactivity, to minimize the time exposure to the patient of the clinical personnel, and when possible to hide the personnel behind some shielding.
DatSCAN examination should be used for patients who don't have a clear clinical presentation of Parkinson's syndrome.
Or if there stays in point a question if this is essential tremor or Parkinsonian plus syndrome. We know that DatSCAN cannot distinguish between among the types of Parkinsonian syndromes as multiple system atrophy or progressive supranuclear palsy. But the patients who are somehow in the gray zone don't respond well to the dopaminergic treatment, these should be or could be investigated by DatSCAN. There are certain other diagnoses that can be diagnosed with DatSCAN, and those are the diseases from the group called Parkinson plus syndromes. And it's multisystemic atrophy, progressive supranuclear palsy, and it also can be used to differentiate between Alzheimer's dementia and Lewy body disease dementia. The truth is, DatSCAN cannot distinguish between the diseases in the group of Parkinsonian plus syndromes. There is urgent need to perform other diagnostic tests to look at the response of the patient to the treatment, to look at other imaging methods, and to do the diagnosis in the complex. There is only one main contraindication to DatSCAN. DatSCAN should not be used in pregnant women. It should not be used in nursing mothers. DatSCAN is generally considered as to be very safe, and the undesired effects are very rare. It has been described the headache can be after the application of the radiopharmaceutical. Sometimes the symptoms of the movement disorder can get worse after this radiopharmaceutical. So it's important to inform the physician about this. However, in the common practice we meet this very rarely.
A DatSCAN examination consists of several steps.
Actually, the first and most important is the patient contact. So the patient meets the doctor, the examination must be explained and the patient history must be taken. Then the patient has to sign an informed consent. Then we take the radioactivity and apply it intravenously to the patient. And then the patient has to freeze for 3 to 6 hours, can go away and return in some specific time. Then he is laid under the camera and we start the process of image acquisition.
Exact positioning of the patient, specifically using a headrest, is important to get high-quality images. A head restraint should also be used to minimize movement. It is hard to correct for motion, so complete immobility is important for good quality acquisition. The radius of rotation defines the resolution of the study and should be set up as close to the patient's head as possible. This will vary depending on the system used, but a 12 to 15 cm radius of rotation is ideal.
So the last part of the DatSCAN examination is the image interpretation. Here we have the images and we see very low background activity and we see normal image. The evaluation is usually visual, so we look as it looks. And what we see here is the nice, symmetric and intense accumulation in both basal ganglia, especially in the caudate nucleus and then in the putamen. Normally it should look like a bean or like a coma. We know that in typical Parkinsonian disease, the degeneration usually starts on one side, is asymmetric. So what we first see is the decrease in accumulation in one side. Usually it starts in putamen. So this is the early phase image of an early phase Parkinsonian disease. Then the degeneration follows and also the other putamen disappears and also the activity in the caudate nucleus decreases. And at the end, when the degeneration is very advanced, we hardly see any activity in the basal ganglia and we see very high activity of the brain background. Let's say the result is positive and we have a sign of the dopaminergic or nigrostriatal degeneration, then this result is handed to a referring physician and he needs to look at this result and put it into the context and to say, okay, this seems there could be a Parkinsonian disease behind these symptoms, and then to set and to offer the patient the treatment with levodopa usually. And once the DatSCAN result is negative, then he knows, okay, the treatment with levodopa will probably not be successful and the problem is somewhere else. The advantage of DatSCAN is that it's a functional imaging. It means sometimes it can show the changes earlier or sooner before they manifest in other imaging modalities, MRI or CT scan. So that's the main advantage of DatSCAN. And the second advantage is that it can help you to somehow differentiate among Parkinsonian syndromes. It means if you have a patient with a tremor who has some movement disorder and doesn't respond well to a therapy, then you can perform this examination to validate if the problem is really in the dopaminergic system.
DatSCAN checklist. 1 dose, 1 vial, crucial to maintain high image quality. Thyroid blocking required, pre-injection only. Check patient medication for potential drug interaction. Good patient preparation and cooperation required. Use of a minimum dual-headed SPECT system and headrest is mandatory. Acquire and process using consistent established parameters. Be aware of movement and scaling artifacts. Check for raised background levels on the image. Always check for asymmetry resulting from patient tilt. Ideally, use semi-quantification software with normal database.